That's a very unfortunate myth because it's totally and completely untrue. Methadone is a life-saving medication. Some patients actually require it to pursue their recovery and to be healthy. Especially pregnant patients, by the way, they seem to do much better on methadone than the other medicine that we have available to us. But with respect to it being a pill mill, that suggests that folks can get whatever they want with no rules or regulations. Clinics that dispense methadone are among some of the most highly controlled and regulated in our country, and the dose limits are strictly controlled. The dispensing is strictly controlled. It's supervised by licensed nurses, and the medications are prescribed by licensed medical practitioners, either doctors, physician assistants, or nurse practitioners. So no, methadone clinics offer life-saving medications to patients who have a severe disease that we call opiate use disorder, that without treatment is chronic, relapsing, and fatal. So it's a life-saving medication given safely and carefully by licensed professionals to patients who desperately need it. This is a pervasive fallacy. Methadone is, it's true, an opioid like other substances in the broad class of substances that patients can become addicted to, but it is legitimate medication. One of the things about it that's unique is it's very long acting, and so folks don't typically get high from it. I'm not saying it can't be misused, but it's seldom misused. But folks take this medication to get relief from their disease, which is characterized primarily by withdrawal symptoms, cravings, and urges to use illicit drugs. Now, we all know that drugs purchased on the street, illicit drugs, are highly dangerous. We don't know what's in them. The drug supply in America today is contaminated with all kinds of things. So there's that, and that we don't know how much you're taking. That's why almost 100,000 Americans a year have died from an overdose from illicit drugs. So methadone, when taken properly, is a safe medication, just like medications that many Americans take to manage chronic diseases. It's very safe, and it's not illicit. We know what we're giving you. We know how much you're supposed to be taking and how much you need to manage your disease. So there's no relationship between the use of illicit substances obtained on the street and medications that we prescribe in our centers, despite the fact that their chemistry makes them similar in some ways and not in others. That's another one that even medical professionals have that, and I think it's instructive. And when I think about my patients today, I try to remember what I thought back when I didn't do addiction medicine, what I thought, and I made some of those same assumptions. But the fact of the matter is that patients can and do have employment. Many of our patients come to us early in the day or late in the afternoon because they have jobs to go to. And many of our patients wear work clothes, but some wear suits because they own businesses that they have to tend to. So our patients are, I would argue, the vast majority of them, you can't tell they're on it. They're not sedated. They're not impaired. Now, it is true, to be totally forthcoming, that you can't be on methadone and operate, for example, heavy machinery. You cannot get a commercial driver's license if you're on methadone. But that doesn't mean that people are sedated or impaired, their cognition's impaired, their memory's impaired. Once they're on a stable dose, which takes some time with methadone, they can be highly successful, highly functioning people in our world that you would never know they're taking it to manage their chronic disease. That's another one. The treatment options for treatment of opioid use disorder are somewhat limited, and while it's true that some patients who try one medication don't do well and move to methadone, some patients, it's clear, will need methadone right from day one. And for example, in today's world, with the prevalence of fentanyl is a highly potent synthetic opioid, and for many of those patients, because of the potency of the drug to which they become addicted, methadone is always going to be the best choice. But I just want to add here that these decisions are not made by medical professionals. I don't make these decisions. We make these decisions and recommendations together. After talking with you about your condition, we lay out the pros and cons, the various benefits of the medication choices, and really, in most cases, we let you decide what's going to be your best choice of treatment. And also, a second important point to make is if we make a choice and it's not going, we can always change course and do something different. It's an ongoing disease that we manage. So the choice you make today might be changed next week, and that's perfectly fine. That's part of what we do in offering the medically driven care that we provide. That is, of the things that we've talked about, the biggest and the worst of the myths. Methadone has, of course, been around since the 50s or the 60s. It's the one we have the most knowledge about. And as we talked about before, patients don't get high from methadone. It manages their disease. Their disease symptoms are cravings, urges to use, drug liking, and withdrawal symptoms. It successfully manages those. So patients who take methadone to manage their disease are not taking it to get high.